Hi, my name is Jade, and this is my honors project number 4 for PSIO 202. And this is basically just going to be like a sex ed talk. I'm going to be explaining what the male and female anatomy system, how it works, what meiosis is, what a haploid and a diploid cell are, also the whole process of pregnancy, menstruation, and also later on consent and STIs, like what are they and how do you and other forms of contraceptives to protect against STIs and pregnancy. So first off, I'm going to start with the female anatomy just because it is very, it's pretty complex compared to the male anatomy. So some of the organs of the female anatomy that it can list, that it includes this, but just not all. There's other accessory organs, but it includes the breast, two paired ovaries and fallopian tubes, the uterus, the cervical canal, the vagina, the labia majora, and the labia minora, and also the clit. So right there is what the uterus would be. This is the female bladder. This right here would be the vaginal canal. That little opening right there into the uterus would be the cervix. That's a fallopian tube, and this is an ovary. And there's also there's a pair of these, so there should be two, like one on the other side. Also, you can see that the uterus lays right on top of the bladder, so that is why when women get pregnant, as the fetus develops, it starts to press on the bladder, which is why they need to go pee a lot. And the outside of the vagina would be right here, so this flap right here would be the labia minora, and this would be the labia majora. And right there would be the clitoris. So, also, I'm kind of sick right now, so excuse the voice, but some of the biggest differences between a diploid and a haploid cell is essentially like the process to make each of those is different. So meiosis is just different from mitosis. Mitosis is what typically occurs in most cell division in the human body. Mitosis is when a cell divides, and this results in the production of a cell that is like genetically identical to its daughter cells. And diploid cells contain like two sets of chromosomes. And meiosis is different from mitosis, in which it is cell division for sexual reproduction, and it results in gametes that are haploid, so they're not diploid. Haploids contain only one set of chromosomes. And the reason is why is when two haploids join together, so if fertilization is successful, there's a sperm cell that's a haploid, and then an egg that's also a haploid. They combine and combine their DNA in the nucleus, and that results in something called a zygote, where it has a full set of chromosomes. And this is what leads to like genetic diversity in most animals. It's also what makes the offspring carry on traits from both the mother and the father. And again, gametes in biological females would be eggs, and the haploid gametes in male is sperm. So what a menstrual cycle is it just what prepares the body for pregnancy if you have a uterus. And it does it every month, hence why periods tend to occur once a month. The menstrual cycle consists of 4 phases. So there is a follicular phase, which is when within the ovaries, there's two main hormones that are kind of interacting. There's progesterone and estrogen. And when these levels, when estrogen rises, this is what kind of like promotes the production of an egg. Also, before I get into that, meiosis is pretty different for females, in which like meiosis kind of starts when puberty starts. So around anywhere from the ages of like 12 to 14, usually. Sometimes it could occur earlier or later than that. But there's meiosis 1 and meiosis 2. Meiosis 1 occurs, believe it or not, when they're actually like a fetus in the womb. So like a female fetus in the womb can have like meiosis 1 start already, like all the eggs are already like present. but those eggs will kind of like take a pause and they won't continue going through meiosis until around puberty, and this is called meiosis too. So that's when meiosis kind of like reoccurs. And that is what the menstrual cycle is, like from the moment that it starts when you're around the age of 12, 14, is literally just a continuation of cell division for your gametes. In males, it also starts at puberty, but it just happens all the time. It's not monthly, so it just occurs all day, every day. Yeah, so during the follicular phase, estrogen just kind of like promotes like an immature egg cell to start developing in a structure called a follicle. And this follicle is also gonna like start promoting and releasing hormones. And that is like the follicular phase. Ovulation is when the other phase is complete, and then finally there is a mature egg that is ready to be released from the ovary. And then this all occurs in like this little tiny structure. There you go. So then during ovulation, an egg will be released from the ovary and it will go into the fallopian tube, and it will like start to travel from here on, where it's all the way towards the uterus. During the luteal phase is when like excuse me. Oh, right. Luteal phase is like when it is when all the hormones kind of work together to basically thicken up the lining of the uterus right here. And this lining wants to be thickened up so that way, like if the egg does get fertilized, it has like a structure to hold on to, an implant to start promoting like a healthy pregnancy, create that little anchoring. And also, fun fact, that little like initial anchoring is what eventually gives rise to the placenta from the mother, the individual carrying the fetus all the way to the fetus, and that's what provides the nutrition for that. And these hormones will keep working together until it gets to the point that like the placenta, it like has like, it's also considered its own organ, the placenta, where it's like formed up well enough that it can just support the fetus on its own. And then like the hormone levels will still keep going, but like it won't be as needed. I believe it's progesterone. Yeah. So that's during the luteal phase. And finally, the last phase is the menstrual phase. So if implantation does not occur, if there's no pregnancy that happens, that is what leads to the bleeding and the shedding every month for a person who has periods. So that lining, also that endometrial lining right here, it has like two layers. There's like a basal layer, and then there's the other layer on top. The layer on top is kind of like what the functionalitis, endometrial functionalitis. Anyways, the top layer, the functionalis one, is what kind of like starts to break down every month, and that's what passes during a period. And that menstrual cycle can last anywhere from 2 to 7 days. That range is like typically what it is. And this happens because progesterone levels start dropping. So that's the main hormone that kind of enacts on this. So next is pregnancy. So if fertilization does occur, this typically follows sexual intercourse. So of course the sperm gets ejaculated from the penis into the vaginal canal, and then that sperm will travel all the way up through the female anatomy, from the vaginal canal to the cervix to the uterus, and eventually either one of the fallopian tubes. And it's like a whole journey. So like millions of sperm are released at once, but only a few ever like survive. I believe sperm can live anywhere from like 7 to 10 days within the uterus. And that's because there's all kinds of things going on. Like the woman's immune system will typically detect that these are like foreign cells and foreign objects and just start attacking it. So that's why some sperm probably wouldn't make it to the egg. It could just like lose momentum too. But yeah, it only takes like literally one sperm to survive to reach the egg to complete fertilization. And actually this fertilization typically occurs in a structure called the ampulla of the uterine tube, which is like kind of like this band right here. That is typically where fertilization occurs. So contrary to popular belief, some people think that fertilization occurs in the uterus, but no, it takes place much further than that. The egg is just gonna like Like the fallopian tube is just going to help the egg travel down into the uterus for implantation. So the uterus is implantation site, but the ampulla of the uterine tube is where fertilization occurs. And yeah, pregnancy is possible for like up to 5 days before ovulation and the date of ovulation. So that is like the period. It's about like a week where like fertilization can occur. So it's really only a week out of a month. But however, there are some ways that like you can still get pregnant from that. Yeah, during fertilization, so the sperm and egg, like I previously mentioned, they just together combine their haploid DNA to create like a full set of chromosomes. And this gives rise to a new cell called a zygote. And then from this point on, that is like when it's considered that like, well, actually, pregnancy is considered to start beginning when this zygote has like implanted onto the lining of the uterus. And this can occur anytime from like 2 to 3 weeks after fertilization occurs. Hence why whenever you do at-home pregnancy tests, it's better to wait like 2 to 3 weeks to know, because sometimes you could get like a false negative if you do it a little bit too soon. So yeah, so early symptoms that like you may be pregnant would be a loss of a period. The reason why, of course, a period would no longer be necessary, as the thick lining in the uterus is needed to support the fetus. Swollen and tender breasts, nausea or vomiting, aka like morning sickness, feeling tired, bloated, constipation, peeing more than usual. Like I said, the uterus is above the bladder. And all of these symptoms are very similar to PMS symptoms that can occur during menstruation, because during menstruation you can also experience cramps, bloating, constipation, all those things, mood swings. So it is really important that like if you suspect you're pregnant, you take a pregnancy test, or you can get a blood test with your primary doctor or at a local Planned Parenthood clinic to know for sure if you're pregnant. Also, this is really interesting. I thought to include it, but they have a section on how like twins occur on the Planned Parenthood pregnancy website. And there's like 2 ways that people can end up having twins. The first way is like kind of like the rare way. It's when there's like an already like fertilized egg and it just randomly decides to split into 2 embryos. And sometimes it's also how like people can end up with triplets. Maybe one of them also decides to like go on and split further or whatever. And since these 2 embryos are identical, they have the same DNA, these are considered identical twins. However, the other way is when there's just 2 separate eggs in the uterus that get fertilized by different sperms. And then these can also implant the uterine lining at the same time, and these will result in fraternal twins. So these twins have like completely different sets of DNA. This can happen naturally by miracle. It can happen if like 2 eggs get released by the fallopian tube around the same time. Or it can also happen during like a fertility treatment. Some couples may want to go through with that if they're having a hard time conceiving. So that can happen too. And fraternal twins are the most common type of twin, and it makes sense. Like I said, this can happen from fertility treatments. So the duration of pregnancy is referred to as the gestational period, and this period lasts around 9 months. It is divided into 3 separate little trimesters. The first trimester is when your body starts to initially go through all the first few changes. I mean, you have that rise of progesterone levels in your body, and this could lead to weight gain, cravings, and all the previous symptoms that I've previously mentioned. The second trimester is when your belly will start to show when it starts getting a little bit swollen. And the previous symptoms that I mentioned before, they can like continue or just get a little bit more enhanced. Third trimester is when it's usually the most intense. By this point, your belly would be pretty big. You could start getting shortness of breath, like the way I feel right now, except I think I just have a cold right now, so excuse me. And also you can get hemorrhoids, you can have the urge to urinate a lot because the baby is constantly pressing on your bladder, and you can even start experiencing some early contractions. So labor occurs when the fetus starts to like reposition and drop towards the lower abdomen. And this triggers a series of contractions to occur to like encourage the baby to be pushed out. And that the body is ready for labor when the cervix, that little opening right here, that tiny one will dilate to 10 centimeters in diameter. And that is when the baby is ready to be pushed out. Also, the main hormone that kind of enhances this whole process is estrogen, the love hormone. It'll enhance like the body to continue to contract until the baby has been like fully pushed out, and then after the baby is out is usually when estrogen levels can drop. However, estrogen also plays a role in circulating during the body when nursing or breastfeeding, and it kind of promotes lactation too. So that was the female anatomy. I'll move on to the male anatomy just very briefly. So some of the organs of the male anatomy that should be noted are the testes, the penis. There's also the glands, prepuce, aka the foreskin. There's also 3 glands within it that kind of contributes to the production of semen. So there is, let me find a better diagram. Okay. Yeah, so there's the seminal vesicles, this structure right here, the prostate gland, aka what people tend to go get examinations for, because sometimes prostate cancer can be a huge issue in older men. And there's a tiny little like bean-like structure right there that is the bulbourethral gland. Oh yeah, and then the penis is also made up of corpus sponginosum and corpus cavernosum, kind of like, just like connective tissue is the best way I can explain it, but it has a bunch of like veins that innervate it, so that contributes to interaction during sexual intercourse. Those veins will get pumped to blood when the individual's aroused, and that's what leads to that. Also, the seminal vesicle is what contributes to 60% of most of the contents of sperm. And the reason why, it contains a lot of fructose to help power up the sperm's mitochondria, and we'll get more into why that's important. Prostate gland also is like what's responsible for like that milky color to it. It has like an alkaline fluid to help the sperm survive in the woman's female tract, because it's a little bit of a more alkaline environment. And we have the bulbourethral that kind of secretes like this like salty fluid that helps clean the uterine tract as it exits, because in male anatomy, the ejaculatory tract and the urine tract go down the same route. So, like I previously mentioned, meiosis for male gametes just occurs all the time, starting at puberty. Testosterone is the main hormone that kind of influences the production of this, along with other biological male characteristics such as a deeper voice or facial hair. So that's why a lot of like people who are transgender transition to identify as male. That's why they tend to take testosterone. It helps like give them those like gender affirming characteristics that they want. Also, both males and females can just have testosterone naturally. I know females do produce like a little bit, just a tiny bit, not a whole lot, but I know that like during menstrual cycles, testosterone levels do kind of rise just a tiny bit. Production of sperm starts in the testes. And the reason why the testes are out of the body is sperm production kind of needs like an environment that has, it's a little bit lower than the body's body temp, so that's why it's outside. It's also innervated with all these muscles that help regulate the heat. That's why like sometimes when it's cold outside, they'll kind of like contract back in towards the body to keep it warm. Or when it's hot and like you're a little bit sweaty, it'll like stretch out. Oh yeah, so mature cells go from like these things called seminiferous tubules, and they travel all the way up here to this little structure called the epididymis. The epididymis is where sperm cells just mature. So the structure of a sperm cell is, it has, let me find a good photo. Oh, there we go. So it has like a head, a body packed with a bunch of mitochondria, and a little flagella. And also, fun fact, that's like the only cell in the human body that has this little structure right here to kind of like help it propel itself. It needs all those mitochondria, and Now it's back to the other gland that I mentioned, that the seminal gland that release like this kind of like fluid that has a bunch of sugar in it, a bunch of fructose. Those mitochondria need that to kind of like help it like power through, have the energy to travel as far as it needs to, especially for 7 and 10 days, to help it reach the egg. Oh yeah, and another important structure to note, I'll talk about it later on when we get into contraceptives, but there's also kind of like a tube-like structure where male gametes travel through, and it is the ductus deferens. And that is typically like the tube that they can snip during a vasectomy to sterilize oneself as a contraceptive. So moving on to contraceptives, so one method that people can use is called fertility awareness. Some people might do this because they don't believe in using birth control, whether it's for personal reasons or religious reasons, and basically they just figure out when they're ovulating. And like I said, there's like a window of time where like pregnancy is like pretty possible during like that week or so. And so people would do this by tracking their menstrual cycle, fertility signs, and this method is often used to prevent pregnancy or even help couples like try to get pregnant. They might purposely do that to want to get pregnant. However, this method is not always like 100% foolproof, of course, because cycles are different for everybody. Some people, they might have a cycle that's shorter, it's every 24 days. There's other people where it's like every 42. Also, people could just have irregular cycles. Not everybody's cycles regular, especially more common in adolescence. So like you may have like one menstrual cycle that's around 30 days and another one that's a little bit longer. So that's also not like a foolproof method to use to prevent pregnancy. So other forms of contraceptives are male condoms, which is what's traditionally most known. It's a barrier. There's also female condoms. There's one where it's kind of like a dam that you put over the opening, or like even like a cup that you can insert to. However, I think male and female condoms, like the diaphragm and the traditional male condom, are the only ones that can also protect against STIs. These other ones I'll go into, they can help protect against preventing pregnancy, but they may not protect against STIs. And that would include hormonal birth control, such as the pill. It's a pill that you take every month. Also, besides protecting pregnancy, the pill can also reduce symptoms of certain disorders, such as PCOS, or even like just regulate menstrual cycles, or sometimes acne too. Personally, I've been told to get on that before for acne, and yeah, I mean, it works. So there's also IUDs. So an IUD is kind of like this like T-shaped structure that they insert into the uterus that kind of like blocks the way of the fallopian tubes to prevent that. Well, no, that's another thing, but it doesn't prevent the egg. The eggs are still gonna come through, but like there's different, the material is what works. So there's a copper IUD. It releases copper that helps hinder sperm movement, and there's also a hormonal one that just releases hormones that kind of mimic the effect of progesterone to kind of prevent a pregnancy. It kind of messes with the whole flow of like an egg getting released from the ovaries. There's also an implant. It's kind of like something that they can insert under the arm right here. It's like a small rod. It's similar to a hormonal IUD. It just releases a bunch of hormones similar to progesterone to help prevent pregnancy. And all three of these are long lasting and they're reversible. You can take them out. There's also the after morning pill, such as Plan B. It kind of mimics progesterone. It's just a big dose of that. However, it's not always effective, and it's more effective if you use it as soon as possible in a 72-hour window. Typically, this is used after like unprotected sex to kind of like in the name Plan B to try to prevent pregnancy if you had sex recently. There's also vasectomy and tubal ligation. So vasectomy is what I mentioned earlier. There was like that, the ductus deferens right here. Basically, they can just like snip both of these, and it prevents sperm from traveling up the tube. There's also where tubal ligation for women, where they can also snip these right here to help prevent the egg from getting released through that tube. Um, those ones can be pretty permanent though. I know vasectomies, they can be a bit reversible, sometimes tubal ligation too. However, that is like a pretty intense surgery, so most people may not want to go down that route, you know, especially if they want to like, you know, have kids later on in life, you know. It's just like maybe for now that it's best to stick with like other forms of birth control to prevent that if you don't want to go that far. Um, Lastly, there's also abortion. I know it's a little bit controversial, but like I think like sometimes it's good to have that legalized still because it is medically necessary, especially physically or mentally for the well-being of the individual carrying the child. Such as, for example, there's something called an ectopic pregnancy, where the egg, it may for some reason decide to implant in the fallopian tube and not the uterus. And as you can imagine, that could lead to a lot of complications. It could lead to bursting of the tube and complications for the mother, and also the fetus may not be able to survive that. So, you know, it's best to look out for the well-being of the mother. Also, as sad as it is, there are such things as late-term miscarriages, where the fetus dies while still in the womb. And this can be incredibly scary for the mother because while the fetus is like decaying, it can lead to an infection for the mother. So in that case, I think an abortion would be medically necessary for that. Also, another thing that's pretty sad is cases of rape or sexual assault, especially towards minors, you know. I think it's good for the victim, mentally at least, to have that choice of whether or not they want to go through that because they may have not asked for that, you know. That was done without their consent. In which, moving on, now we're going to talk about consent. So consent is when an individual agrees to engage in sexual activities with another person. So everybody has the right to consent and to be able to just set boundaries for what they're comfortable doing and want to engage in with another person. Sexual activity without consent is, of course, sexual assault and rape. And that can include any kind of activity done without consent, whether it's oral sex, genital touching, vaginal sex, anal sex. Also, sex between an adult and a minor cannot consent to that. So it's not always just limited to vaginal sex. It can include other forms of body touching that's not wanted. Planned Parenthood goes by the acronym sex is as easy as fries. So F stands for freely given, basically saying that like consent must be freely given. It's also reversible. That's what the R stands for. So let's say like in the middle of it, you just decide that even though you're with that person for a year, you're in a relationship with them, that's your long-term boyfriend. At any point, if you're just uncomfortable with something, you're allowed to take back that consent. It's your body. You don't always have to go through with it. Also informed. So it's also considered sexual assault if you're with a partner and let's say like they lied about using protection and really like they decide to take it off. That is not consent because you don't know if that person is trying to get you pregnant when you did not consent to that, or if they're carrying an STD, you know. Also enthusiastic is what the E stands for in the acronym. So it's gotta be like done with enthusiasm, not manipulated into it or anything. And also specific, like let's say like you consented to like just kissing somebody, that's not an invitation to something any further or other activities you don't want to do. So it has to be specific to just that. Lastly, we're going to talk about STIs. So on the Planned Parenthood website, they have like a great like selection and description of all the various common STIs that are possible. And I think it's good because it informs you which ones are treatable and which ones are not. So, and that's incredibly scary too. That's also like big importance on using like a barrier condom if you're having sex with somebody, and also get tested too so you don't like unwillingly spread something to another partner. So some of the most common ones are chlamydia. Chlamydia is caused by a bacterial infection. It can also be asymptomatic, which is scary. So it's really important to get tested if you're sexually active. It's also scary, but it's really high risk for the fetus during pregnancy. So there's something called prenatal infection, And this happens when the fetus in the uterus, if the mother, the person carrying them, has a chlamydia infection. If they get exposed to the cervix to that infection, they can also get sick. And this can result in complications such as childhood pneumonia in the lungs or even like an eye infection. And in some extreme cases, it can even lead to blindness, which is incredibly scary. But thankfully, pregnant women can get treated, but they just need to be like screened and tested for it. And it's really important to do that if you suspect it, if you are pregnant. There's also gonorrhea. It's very common, also asymptomatic, caused by bacterial infection. HPV has various strains. It stands for human papillary virus. It can lead to genital warts. This one can like go away on its own sometimes, so you don't always have to treat it. However, if you leave it untreated for a really long time, it can lead to a bunch of cancers. So it's good to be responsible and treat that. There's also hepatitis B that is a virus and it can cause liver damage. There's also herpes. It's also a common STI that infects the mouth and genitals, and that's what kind of like leaves the stereotypical sores you might see. That one has no cure, unfortunately, but the symptoms can be managed. HVI and AIDS, no cure as of this time. From one of my other classes, we were talking about it, and they are kind of like working on something to happen, so that's cool. It's also caused by a virus. It can be asymptomatic and like sudden onset, and symptoms are manageable. There's also pubic lice, aka crabs, syphilis, common bacterial infection, and that one can be treated, but it's also dangerous if you don't, so just do that. And that is the end. Thank you.